And so I just wanted to spend a second to speak about some coping strategies. And the whole essence of these strategies is really to help individuals build mental resilience, to help them withstand maybe the pressures or the stressors that they may have either on a daily basis or, based on the semester or things that may be happening in their life at the time. To highlight some effective coping strategies here, one of the things that I had mentioned in one of the other questions was maintaining a routine, such as, waking up at the same time, trying to go to bed at the same time, incorporating exercise or journal writing and reading into your day, being sure that you're eating a really good meal. It's interesting how, and there's been a number of studies now that link nutrition with mental health. And so simple things like, throwing away that burger and opting for, a turkey sub instead, things like that, that would really help provide your body with that energy and that nutrients is really important. And as well as all of these things in regards to making a routine help provide a sense of purpose for your day, especially if you're facing such things as like depression. It may, you may begin to feel a little bit hopeless and a sense of despair may set in. But when you're able to maintain a routine, you have something to look forward to, you have something to get up and get ready for. Incorporating grounding techniques, such things as mindfulness, meditation, if that's something, or even just breathing activities and progressive relaxation, taking that deep breath in, and gathering, feeling it throughout your body, recognizing any parts of your body that maybe have some tension and releasing that with the breath. Simple things like that to help, for example, if you're dealing with anxiety, say you have to go in and do an exam, or you're about to go into a group assignment and you're feeling quite a bit of anxiety about that, and paying attention to what's happening in your body. Emotional regulation, that mind-body connection. Your body speaks to you. It tells you things. There are physiological things that are happening when you're feeling anxious, but there's also physiological things that are happening when you're having a post-traumatic experience, or for example, if you're having depression. So just paying attention to what your thoughts are telling you, paying attention if they're profusely negative, and working on some cognitive restructuring, which would be reframing these situations in a more positive light. And that may be more in line with the evidence that's actually out there, because sometimes our bodies and our minds will automatically respond to a situation based on how we've interacted with that situation in the past. It may not be reflective of what is actually happening in the here and now. So kind of taking the time to be in tune with what's happening within you. Practicing gratitude, whether that is in a journal, as I mentioned before, or daily affirmations that you can say to yourself, simple things like speaking to yourself in the mirror, and telling yourself that it's going to be a great day. That in and of itself begins to really kind of rework those pathways in your brain, and they provide you with a sense of meaning. The art of distraction. This is one that I really do encourage all the time. And what I do want to highlight here, it's not to be confused with avoidance. You don't want to avoid what you're feeling. You don't want to avoid what's happening within you, because those are really important indicators that you need to pay attention to something. But the art of distraction means that you're not ruminating, you're not engulfing so much time and energy into those things that may potentially be negative and taking you away from a positive space or promoting your mental wellness. Time blocking is a great part of that. So spending, maybe 2 hours of studying and an hour of a break, or, you do 3 hours of studying and then you're going to go and have a coffee with a friend. Those things are really important in helping you take yourself out of an environment that may be highly stressful, that may be anxiety ridden, and helps you kind of rechannel your energy in a different direction. Positive self-talk that is in line with gratitude, practicing a sense of self-compassion. We're humans. We are not perfect. We are not machines. We cannot do everything. And as much as we do our best, our best has to be good enough. And we have to congratulate ourselves for those small wins and those small victories and pick ourselves up. Establishing boundaries and healthy boundaries is a key, and it's a must. Recognizing, relationships or situations that are not conducive to your mental health, and being able to assertively communicate, what it is that you might need in the moment, and knowing that it's okay to say no. And I've also highlighted here seasonal affective disorder. We're in the winter months, but not to confuse that with the fact that you can also have seasonal affective disorder in the springtime as well. So paying attention to, again, if you're seeing an onslaught of emotions that you may not have had the preceding semester. In the wintertime, one of the things that's oftentimes recommended is light therapy, and you can get one of these lamps on Amazon. But the other one is psychotherapy, and in extreme cases, seeing your family physician for perhaps, medication if needed be. The other thing that I recommend highly is prioritizing self-care. And as I mentioned before, this happens on a continuum, and there's not one thing that fits one person. You may find that you thrive in different categories here, whether it be physical, emotional, spiritual, intellectual, or social, but finding something where you can spend that time taking care of yourself and doing something that you find is enjoyable and pleasing. So within the physical sense, it's some of the things that I mentioned before, such as, exercise and eating healthy. I had a client one time who explained to me that the fact that she got up and put on her makeup, that was such a time for self-care for her, right? And so thinking about these different things that are important to you, that make you feel good, how you can incorporate them in your day, painting or dancing, meditating, or if you're an individual who, for example, have strong spiritual connections, spiritual ties, connecting with your spiritual community may be a great thing to do, or even creating a vision board, having some type of focus for the future, where it is that you want to go, what is it that you want to do. Those things can really help you on days when you might be feeling specifically low. Reading a book, listening to a podcast, or spending time with family and friends, meeting somebody new, engaging in clubs and organizations on campus, as a way of also building your support circle and building your sense of community, as well as some mindfulness apps. There's some great ones out there that I highly recommend for individuals, things that you can do maybe perhaps just before bed or just before an extremely anxiety-ridden activity. As we are in Black History Month, I did think it was really important to highlight some racial factors and these factors that do impact the mental health of individuals who are Black. One of them being racial stress. This in itself, especially if you're faced with an onslaught of racial stress continuously, whether it be microaggressions, whether it be engaging in conversations that are continuously racist in nature, they can really heighten heighten your stress levels. And just the actual thought of having to engage in an activity that may perpetuate stress can also be very daunting and anxiety ridden. There's also racial battle fatigue, and oftentimes this comes by just the mere exhaustion of having to continuously be inundated with racial experiences or racial discrimination, for example. Racial trauma, and this is kind of like the hallmark of all racial factors. And these oftentimes are encounters that really erode at self-confidence and sense of self and self-esteem, and can actually lead to internalized racism or a dislike or extreme dislike of oneself. There's anti-Black racism, which oftentimes happens in the institutional level and is quite systemic in nature. And then racial gaslighting, where sometimes you might feel a certain type of way, but then you're gone on to be told that your experience is false, or minimizing those experiences. But they all do play an impact and do play a role, to impact the individual. And so something to pay attention to, that if you find yourself, experiencing one of these racial factors, is finding an outlet, finding somebody that you could talk to, coming to places, for example, like the mental health group on campus, where there may be a safe space for you to be able to discuss this, finding a therapist that you can speak to. And in regards to seeking support, I just wanted to highlight certain things like the Campus Wellness Center. I know U of T has great student supports when it comes to mental health. So reaching out to, for example, your student union or the mental health group, visiting the local campus wellness center. Social isolation. Oftentimes when we're feeling our lowest, the first thing we want to do is isolate. We don't want to burden people. That's oftentimes the first thing that comes to mind. We don't want to be a burden to other people, but as well, there may be a sense of shame or a sense of guilt, or for example, if you're in a family or amongst a social support network where talking about your mental health is not necessarily something that happens, or when you do talk about it, it's more in line with, kind of just get over it. But one of the things you want to do is find a safe place. It may not be a group of people, it may be just one or two individuals that you can reach out to that you trust. Another thing to do is connecting with a local distress center where you can stay anonymous. You can speak to somebody about what may be going on in your life right now. I also know that there's some campuses that offer peer support as well. And if you are facing racial traumas, working with someone to develop a racism recovery plan. And within this plan, what you do is you work towards identifying some self-care measures that you can use when you are facing racial stressors. And then from there, how to cope if you reach to a point of crisis, and then how to kind of recalibrate yourself post-crisis as well. And then if you do need to, and there's room for this as professional help, seeking out your family physician, for example, maybe a first line for some individuals, or finding a therapist within the province of Ontario. 310 COPE is a great resource to reach out to, or also connecting with us here at Black Mental Health Canada. We have a number of different resources, and we can connect you if you need to. And as well, I do want to highlight as well individuals who may be in absolute crisis. First and foremost, calling 911 or going to your local emergency room, hospital emergency room. But there are also some other crisis lines that you can reach out to. One of the ones that I really like to promote is the Kids Help Phone. It's not just for kids. I know it says Kids Help Phone, but it's also for young adults. And they also have a text option as well. So if you don't want to talk to somebody, but you just want to have the option of just texting and reaching out, feel free, you can do that as well. And then finally, I just want to say thank you, but I think maybe if you have more questions, we can get into that as well. But just thank you for having us here at from Black Mental Health Canada. There is a QR code there that will direct you directly to our website, or if you wanted to connect with me myself, you can do so via email. My email is there as well.
Thank you so much, Shanique. That presentation was lovely, so informative. Thank you for making that. Honestly, we had some more questions, but you answered all of them in your presentation. That was amazing.
Yeah. You've included all of the aspects of that, what we wanted to ask, and how you've included all of the different categories and groups of things, and the different perspectives of ways to look into things. That's really incredible. And thank you so much for your slides.
Oh, thank you for having me. Really appreciate it. Thank you.